Assalamualaikum warahmatullahi wabarakatuh and a very good morning to everyone. So I'm Dr. Hanim. I'll be your lecturer in charge for the respiratory system, and today we're going to have our first lecture on the respiratory system. So for anatomy, we'll be having 4 lectures for this system. So the first 2 lectures is basically the gross anatomy of the respiratory system, where we're going to cover the upper organs and the lower organs of the respiratory system. And the third lecture, we're going to have the embryology of the respiratory system. So we're going to see how the respiratory system developed. And for the fourth lecture, we're going to learn about the histology of the respiratory system. So this is the learning outcome for this lecture. So the student is expected to be able to define the term respiration and its component, and also to be able to describe the structure, the blood supply, the innervation, and the lymphatic drainage of the respiratory organs. Basically, the nose, the pharynx, the trachea, the larynx, the trachea, and the bronchial tree. For the respiration, it has to have 3 processes. In order for the respiration to complete, we need to breathe, we need to have the pulmonary respiration, as well as the internal or cellular respiration. But in this, for anatomy, we're going to cover only these 2 types of respiration. I think the internal or cellular respiration will be covered in physiology. Respiration refers to external respiration and internal respiration. So the respiration itself is a process when there is a gas exchange between the atmosphere, the blood, and the cells. So this is your atmosphere. When you breathe in, we take all the gases outside, inside, to go inside to our body. And through the multiple respiratory organs, we'll take the gases into the lungs and goes into the blood air barrier when there is gas exchange occur. So this is external respiration, the exchange of oxygen and carbon dioxide between body interstitial fluids and the external environment. So the internal respiration or cellular respiration is the absorption of oxygen and release of the carbon dioxide by the cells, and it occurs between the organs and the capillaries of our body. So the external respiration involves the breathing and the pulmonary respiration. So the breathing is the movement of air into and out of the lungs, breathing here, and the pulmonary respiration is the gas exchange between the blood and the alveolus. So the lungs contain alveolus, and the exchange of gases, here we call it the pulmonary respiration. So moving on to the next learning outcome. So we're going to describe the structure, the blood, the nerve supply, and the lymphatic drainage of these organs. Yeah. So the nose, the pharynx, the larynx, the trachea, and the bronchial tree. The respiratory organs basically is divided into 2 parts: the upper respiratory organs and the lower respiratory organ. So what is the upper respiratory organ? So basically we have the nose, and its cavity, and the paranasal sinus that drains into the nasal cavity, and the pharynx. For the lower respiratory organ, so we have the larynx, the trachea here, the bronchi, and the lungs. So bear in mind that sometimes certain books say that larynx is part of the upper respiratory organ, but in this lecture, so I'll just follow the standard anatomy textbook saying that the larynx is part of the lower respiratory organ. Other type of classification of the respiratory organ is based on the function. It's either conducting portion of the respiratory organ or the respiratory portion where the gas exchange occur. So the conductive portion is where the air is conducted from the external environment into the lungs. It can be outside or inside the lungs. So not necessarily all the organs that located inside the lung is responsible for the gas exchange. Yeah, so it also maybe only has the conducting function. So the nose, the pharynx, the larynx, the trachea here, the bronchi, yeah, the bronchi here, and down to the terminal bronchioles is the conducting portion of the respiratory organ and of the respiratory system. So for the respiratory portion, where the gas exchange it occurs in the respiratory bronchioles. So I just of my picture here. So the alveolar duct, and the alveolar sac. So moving on to the upper respiratory organs. So we're going to talk about the nose, the nasal cavity, the paranasal sinus, and the pharynx. So the nose basically consists of the external nose and the nasal cavity. So this is your external nose. So basically it formed by the bones, the cartilage, and the soft tissue. The external nose has the orifice that's separated by a nasal septum, and this nasal septum also present in the nasal cavity that that separate the nasal cavity into the left half and the right half. And the framework of the external nose basically consists of the nasal bone, the maxillary bone, and also the frontal bone. And the lateral wall of the external nose, or we call it the L1 is immobile. Sorry, is mobile. It means that you can actually move the lateral part of your nose. You can actually do it on your nose now, and you can see that your L1 is mobile, and it surrounds the orifice that present on the external nose. So for your homework, you can actually try to describe the blood and nerve supply of the external nose, and please share your homework, your assignment to the Padlet link at the end of this lecture. So we're going to proceed with the nasal cavity. So the nasal cavity started from the nostril here down to the posterior part of the nasal cavity, or we call it the posterior nasal aperture, where it communicates with the nasopharynx. In the nasal cavity, we have the roof, the floor, and the nasal septum. Yeah, and we also have the lateral wall and the medial wall. Yeah, the medial wall is your septum, and the lateral wall, this is your lateral wall that has the concave or turbinate. So we have the superior turbinate, middle turbinate, and inferior turbinate. So this is your lateral wall, and this is your medial wall. First, we're going to talk about the nasal septum. So the nasal septum, or your medial wall of the nasal cavity. So it made from the cartilage, the perpendicular plate of the ethmoid bone here, and your vomer. Okay, this is your medial wall or the septum. So basically, it's a combination of cartilage and the bones. Yeah, and lateral wall. So this is your lateral wall. It consists of multiple bones, and it has superior concave here, the green one, the middle concave, and the inferior concave. The area below each concave, we call it the meatus. Yeah, the meatus. So this meatus is actually it's a place of drainage for multiple paranasal sinus. So that we're going to talk about later. So what about the roof of the nasal cavity? So this part explains the roof of the nasal cavity. We have the anterior part, we have the nasal and the frontal bone. So nasal, and here the frontal bone. In the middle part, we have the cribriform plate of the ethmoid bone. So this is the cribriform plate, yeah, the one here, like this is the cribriform plate of the ethmoid bone. And posterior part, we have the sphenoid bone. This is the roof, yeah, the roof of the nasal cavity. And what about the floor? So the floor of the nasal cavity basically consists of the palatine process of the maxilla. So this is the palatine process um, of the maxilla and horizontal plate of the palatine bone. This is the horizontal plate of the palatine bone. Okay, so we cover the roof, the medial wall, the lateral wall, and the floor of the nasal cavity. Okay, this is how nasal cavity looks like on cadaver. And this is your lateral wall of the nasal cavity. And this is your nostril. And this is your lateral wall. You have the superior turbinate, middle turbinates, or inferior turbinates, or concave. You call it concave. So the area below each turbinate is the meatus. And this is your olfactory area in the nasal cavity that responsible for your sense of smell, and it contains the olfactory nerve. All right, so in another view, we can see that this is your superior concave and inferior concave and middle concave and inferior concave, and the area here is the meatus. We call it the meatus. It's where the paranasal sinus is open into. This is your nasal sinus, the paranasal sinus, all right, which will be talked about again later. All right, and apart from that, we have another view. All right, so I will just rub this off. So this is your medial view, yeah, your medial wall of the nasal cavity. Basically, this is your septum, yeah, the septum that consists of the cartilage and the bone. All right, the blood supply and the lymphatic drainage of the nasal cavity. So the blood supply of the nasal cavity comes from the maxillary artery, from the external carotid artery. And one of the important branches for the nasal cavity is the sphenopalatine artery, because it anastomosis with the septal branch of the superior labial branch of the facial artery on the medial wall of the nasal cavity, and we call it, this one is the Little's area. So there is a clinical significance of Little's area that I'll be talking about later. For the lymphatic drainage, the vestibular area of the nasal cavity, so the vestibular area is within here, so within the nostril, it's drained into the submandibular node, and the remainder of the nasal cavity is drained into the upper deep cervical nodes. So now we're going to talk about some clinical applications. So epistaxis is a digital trauma to the anastomosis area. So where is the anastomosis area? It's on the Little's area. So this is your Little's area. It's the anastomosis area between the sphenopalatine artery and the superior labial artery. It's located on the nasal septum, just inside the nasal vestibule, and this is where the epistaxis or nosebleed commonly occur. Moving on to the paranasal sinus. So the paranasal sinus are the cavities in the bones in the skull that communicate with the nasal cavity. Yeah, remember that I mentioned the meatus, the area between each concave or turbinate. And this is where all this paranasal sinus is drained into. So these paranasal sinus are lined by a mucoperiosteum and filled with air. It lightens the skull and it resonates the chambers for speech. So we have the maxillar sinus. So the maxillar sinus is here. So in the X-ray, you can see this is your area of maxillary sinus, and you also have the frontal sinus. So this is your frontal sinus here. So in this X-ray, you can see that this is your frontal sinus. The sphenoid sinus. So we have the sphenoid sinus is a little bit posterior. You can't really see in the X-ray, but when you actually remove all the sinuses, and like in this picture, you can see that the sphenoid sinus is located posteriorly, and you also have the ethmoid sinus. So the ethmoid sinus is here. All right, this is your F1 sinus. This is your F1 sinus. So all the sinuses we drain into the meatus, but which sinus drain into which meatus? Because we have three parts of meatus. We have superior meatus, middle meatus, and the inferior meatus. So for the posterior meatus, the posterior ethmoid sinus is drained into the superior meatus. The posterior group of the ethmoidal sinus drain into the superior meatus. The middle meatus is where the maxillary sinus, the ethmoidal sinus, the anterior and middle group, and the frontal sinus is drained into. This is your middle meatus. And for the inferior meatus, this is your inferior meatus. It's the lesser lacrimal duct is drained into. So the lesser lacrimal duct is a duct that that responsible for the tears. Yeah. Okay, so this is another picture showing the multiple sinuses that present in the upper respiratory tract. So you have the frontal sinus, the ethmoidal sinus, the maxillary sinus, and the sphenoidal sinus. And this is just another table that summarize the sinuses and its opening. So we heard often about the sinusitis. So what is actually the sinusitis? So the infection of the paranasal sinus, where the membranes of the paranasal sinus become inflamed due to infection or allergy. So you can see that this is your normal maxillary sinus, and this is where the membrane of the sinuses become inflamed. You can see the increase in opacity on the X-ray. So this is the this condition is called the sinusitis. Now we're going to learn about the pharynx. This area, the whole area is pharynx. We call this area pharynx. And the pharynx is basically a muscular tube that lined by the mucous membrane, and it's funnel shaped in structure. And this is your funnel. Funnel means it's wide on the upper end and become narrower in the lower end. It continues with the esophagus down here, and in the pharynx, the air and the food pathway crosses, yeah, with the function of the epiglottis, which controls the patency of the upper airway of the pharynx. So pharynx anatomically is divided into nasopharynx, the oropharynx. Yeah, let me do some marking. So this is your nasopharynx, your oropharynx here, your oropharynx, and your laryngopharynx. So the nasopharynx communicates with the nasal cavity and anteriorly, and with the tympanic membrane by the eustachian tube here. So this is the opening of the tympanic cavity in the nasopharynx, and it ends at the lower part of the soft palate. And for the oropharynx, it started from the lower part of the soft palate down to the upper part of the epiglottis. And this area here is defined as laryngopharynx, where it ends at the lower part of the cricoid cartilage. Yeah. So now we're going to talk about the larynx that connect the pharynx and the trachea. So this is your pharyngeal area, and this is your trachea. Yeah, this is your trachea, and this is your larynx. So larynx located from C4 to C5 vertebral level. So it's located from C4 to C6 vertebral level. And larynx basically consists of multiple small cartilage, and some membrane that connects all this cartilage. So what's important here is the presence of the vocal cord. This is your vocal cord. So what's important about the vocal cord? It's, of course, is for your speaking, for your phonation, and it's control the air that coming in and out from the trachea into in and out from the trachea. So we have the vocal cord that present in the larynx. So this cavity, we call it the laryngeal cavity, that has the vocal cord inside the larynx. Like I mentioned to you earlier, the larynx consists of cartilages and the membranes. And now we're going to look at one by one what are the cartilages of the larynx. So it has 3 unpaired cartilage and 3 paired cartilage. Yeah. So we have the thyroid cartilage. So we have the big one, the thyroid cartilage here, and you have the epiglottis, and we have the cricoid cartilage. And this is cricoid cartilage here. So this is your anterior cricoid cartilage, and this is the posterior part of your cricoid cartilage. And you also have the small paired cartilage that present in the larynx. You have the arytenoid cartilage, and the coniculate cartilage. And you also have another one, the cuneiform cartilage. The cuneiform cartilage is present in the membrane in the vocal cord that cannot be seen here. And this is how the cartilage looks like. So this is your epiglottis. This is your epiglottis. Yeah. And this is your cricoid cartilage. This is your cricoid cartilage. This is your cricoid cartilage. And this is your thyroid cartilage here. This is your thyroid cartilage. And you also are part of your cricoid cartilage. This is a thyroid, this is cricoid, anterior and posterior cricoid cartilage, and this is your epiglottis. But we cannot see the small cartilage in the cadaveric picture. So now we're going to talk about the muscles of the pharynx. The muscles of the larynx. It classifies into extrinsic and intrinsic muscles. So these are your extrinsic muscles. It can be divided into the suprahyoid muscles and the infrahyoid muscles. It means that this is your hyoid bone. Anything that are located superior to the hyoid bone is we call it the suprahyoid bone, and anything that inferior to the hyoid bone is the infrahyoid bone, right? These muscles basically move the larynx vertically during the swallowing, so during the up and down of the larynx. And we have the intrinsic muscles of the larynx. So what's the function? It's very important because it moves the vocal cord. It controls the vocal cord. And why the term intrinsic occur? Because the attachment of the muscles is basically only at the laryngeal area. Okay, and what's interesting is that all the intrinsic muscles are innervated by recurrent laryngeal nerve except one of the muscles, that is the cricothyroid muscles. The cricothyroid muscles here, the cricothyroid muscles is supplied by the external laryngeal nerve. So what are the function of this intrinsic muscle? Why is it so important? Because since it controls the vocal cord, so the breathing is controlled by the intrinsic muscles. The opening of the vocal cord is controlled by the intrinsic muscles, as well as the phonation. Because when your vocal cord doesn't move, you can't your voice can't be projected out. So another assignment for you, you can try to describe the blood supply, the sensory, and the motor supply of the laryngeal muscle. I just want to mention, when you do this assignment, you notice that the sensory and the blood supply, it's divided into the upper part of the larynx and the lower half of the larynx, or the one that above the vocal cord and the one that below the vocal cord. So this is your vocal cord, and this is your vestibular fold, and this is your vocal cord. And this area between the vocal cord here is the rima glottidis. So this rima glottidis in the area between the vocal cord that can be wide or narrow depending on the movement of the vocal cord that controls by the intrinsic muscles of the larynx. Alright, I would like to mention a little bit on the voice production by the vocal cord in the larynx. So the larynx contains vocal cord that produce sound. Right, the down vocal cord produce high pitch and the relaxed vocal cord produce low pitches. This is the from the superior view of your vocal cord, okay, and this is your vocal cord, right, and this area is the rima glottis. So this area is the rima glottis can become wide or narrow depending um, on the vocal cord itself. And this is another view of the larynx, sagittal view, yeah, of the larynx, that um, you can see the presence of the vocal cord, the vestibular fold, and the rest of the cartilage of the larynx. Okay, moving on to the trachea. So the trachea connects the larynx to the bronchi. Yeah, it's a mobile cartilaginous and membranous tube. It's around 10 to 12 centimeter tube, and it begins at the lower border of the cricoid cartilage at C6. So remember, the cricoid cartilage is part of your cartilage in the larynx, and it ends at this sternal angle. Yeah, sternal angle at T4 and T5. Basically, this is your trachea here. For your assignment in trachea, you can actually try to state the relation of the trachea in the neck and the superior mediastinum. So you can try to look at the anterior relation, the posterior relation, and the lateral relation of the trachea. Since the trachea is basically located in the neck and extended down to the superior mediastinum. Another assignment for you, you can actually try to describe the blood and the nerve supply of the trachea and the lymphatic drainage of the trachea. And you notice that for the blood supply of the trachea, it divides the trachea into the upper two-thirds and the lower one-third. For some clinical application, the tracheostomy and the intubation is a method of bypassing the obstruction that occur in the upper respiratory organ. So this is the tracheostomy, and this is the procedure of intubation. So in emergency, usually did this kind of procedure to maintain the oxygen saturation, to maintain the ventilation of the patient. After trachea, we have the bronchi, or the bronchus and the bronchioles, and later we have the alveolus. So the bronchial tree is actually the branch from the bronchi that form the bronchopulmonary segment. So the trachea bifurcate into the principal bronchi at the sternal angle and the principal bronchi, and further divided into the segmental bronchus and give rise to the bronchopulmonary segment. So basically, the bronchopulmonary segment is originally has its own segmental bronchus that originates from the principal bronchi that becomes the bronchopulmonary segment. So basically, there are differences between the right and left bronchus. So we see that the left bronchus is actually longer when you compare with the right bronchus. The size, the diameter is a little bit narrower compared to the right one, and the direction is more horizontal compared to the right bronchus, which is more vertical. It means that the foreign body tend to pass on to get into the right bronchus when you compare to the left one. And now I'm going to talk a little bit on the division of the bronchi of the right bronchus before it enters the lung. So the right principal bronchus basically divide into the superior lobar before it enters the lung here. Right? And then whereas for the middle and inferior lobe, it divide fully in in the lungs. For the left bronchus, it all develop or divide uh, inside the lungs. So the other thing is that the relation, the important relation for the bronchus is the presence of the aorta, whereby the left bronchus is basically located below the arch of the aorta. So we go back to the bronchopulmonary segment again. So the bronchopulmonary segment is a functionally independent section, and it's supplied by a tertiary or segmental bronchus, and it has its own artery, nerve, and lymph vessels. Um, so notice that I mentioned artery, not the veins, because the vein is located in between the bronchopulmonary segment, not inside uh, or part of the bronchopulmonary segment. So what are the criteria of the bronchopulmonary segment? So it's pyramidal shape. So its apex is located towards the root of the lungs, and its base is at the pleural surface. And it's separated by septum. So septum, and each bronchopulmonary segment is surrounded by a septum and supplied independently by a segmental bronchus and the pulmonary artery, and is drained by the pulmonary vein that located in between the segment. And because of these features, it is surgically resectable. You can easily remove the bronchopulmonary segment during surgery. Since bronchopulmonary segment can be resected, it is resectable, so it can be numbered. Yeah. So for the right lung, for the superior lobe, I just give a few examples. You have the apical segment, bronchopulmonary segment, the posterior bronchopulmonary segment, and the anterior bronchopulmonary segment. And the example for the left lung, so left lung have two lobes. So for the superior lobe, so you have the apical segment and this posterior segment, the superior lingular segment, the inferior lingular segment, and from the middle side you can see the superior lingular segment. Okey, betul ke apa yang saya cakap ni? So the apex, the posterior, the anterior segment, the superior lingular segment, and the inferior lingular segment. Alright. So you can actually make out the rest of the bronchopulmonary segment that present in the lungs for right and left lung. So as a recap, so now you are already familiar with the respiration and its component. It's internal and external respiration, the breathing and the pulmonary respiration. Now you know your respiratory organs, the blood supply, the innervation, and the lymphatic drainage. And you also have few assignments, and you can actually post your assignment in the Padlets in the link given. Thank you very much for your attention, and you can please reach out to me if you have any problems, any questions, any doubts regarding this lecture. Thank you very much.